Tonight, Maine's healthcare workers are spread thin. 413 people are in the hospital with COVID-19. That is a record high. The surge is happening as the Omicron variant rises in our state. It now accounts for almost 80% of all cases in Maine, according to our state's public health leaders. So far, the number of people in ICU beds or on ventilators is not pushing toward new records, but public health doctors say it's still too early to tell if this surge will be marked by less severe illness. Welcome to News Center Maine at 5:30. I'm Chris Costa. Both Northern Light Health and the Maine CDC held COVID-19 updates today. So tonight, let's start with the three things you need to know. First, there's new guidance from the Maine CDC and Department of Education about contact tracing for schools. They're allowing schools that have universal masking requirements to suspend contact tracing. Superintendents told the CDC that contact tracing is getting overwhelming and unproductive because of how fast Omicron is spreading. Maine CDC Director Dr. Nirav Shah says Omicron is 3 times more contagious than the Delta variant and that people become contagious earlier, too.
In short, trying to catch Omicron by contact tracing is like trying to catch a bullet train on a bicycle. The train is long gone from the station by the time you even get your helmet on. Those same Omicron factors at the same time reduce the effectiveness of contact tracing in schools.
State Superintendents Association Executive Director tells us that as of its last survey of schools in November, about 88% of them require all staff, students, and visitors to wear masks at all times on school grounds. Number two, the Northern Light Health says a record number of its healthcare workers are out due to COVID-19. This afternoon, the hospital system's leader said 605 employees are either quarantining, have tested positive, or are waiting for test results. That number is an all-time high. And in the last week alone, 184 workers tested positive. 5 Northern Light Health hospitals are shifting to what's called contingency staffing levels, allowing them to bring people back to work faster. More severe than that is what's called crisis staffing levels. Under crisis staffing, employees who test positive for COVID but are either asymptomatic or have improving symptoms can be asked to come back to work. But Northern Light Health leaders say they have not activated crisis staffing at any location and that using it is a last resort.
I think the guidance that we've been provided by the CDC is a framework for hospitals and healthcare providers to follow, but it does give them their own expertise and judgment to apply to their local organization.
Maine Health tells us last week nearly 950 staff members were out and that the situation has not significantly improved. A spokesperson tells me none of its hospitals are in crisis staffing levels as of right now. And number 3, more COVID-19 testing options are coming available in Maine. This comes as the number of people getting tested in our state is at an all-time high. Today, the Cross Insurance Arena in Portland started offering tests through the company Curative. That's the same company that operates the Portland Jetport location. Also, Westbrook Public Safety and the Augusta Armory are expanding how many tests those sites can perform each day. And Maine is purchasing 250,000 Buy Nax Now tests that will be sent to Walgreens locations as well as healthcare sites, schools, and congregate settings like nursing homes and jails. The state is hoping to announce more increased testing options soon.
I'd urge folks to cast a wide net if they need testing, both looking for PCR appointments, but also looking to see if rapid antigen tests are available. I say that freely acknowledging that they are tough to come by.
And I will just say we are hopeful that the Biden administration will be releasing some more tests for states. We've heard the rumors that there could be announcements in the coming days, so we look forward to that as well. Needless to say, as part of our daily work, how do we expand testing options?
Now, starting on Saturday, new federal rules go into effect that allow people to get up to 8 over-the-counter rapid tests for free each month if they have private insurance. That means a family of 4 can get 32 tests each month. Stores are still working out whether the tests will be free at checkout if you show insurance or if you'll have to submit a claim to your insurance for reimbursement. The feds are incentivizing stores to make it free at checkout. Those are the 3 things you need to know.